All right. So our first topic of the day is COVID-19, RSV, and what to know about for the fall.
What's RSV, first of all?
Yes, it is respiratory syncytial virus. I was going to get to it,
Sorry.
but it's okay. I know that everyone needs to know. So let's first start with what we know. COVID-19, that's kind of the monster that we've known for the past 3 years. So hospitalizations have been trending upward since July, but experts are not expecting a huge spike and don't advise people to change your behavior. So continue living your life. Just know that hospitalizations are on the rise. And for context, the CDC has reported 8,000 new hospital admissions for the week ending in July 22nd. But at the same time last year, the number was more than 44,000. So we have seen a rise, but it's nowhere near what we saw last year. So we're doing better with pandemic control. And wastewater samples, because we now can't track cases by the states because the pandemic advisory has ended. So we're now tracking COVID cases through wastewater. So the wastewater samples show a general uptick in cases of COVID across the country, with the most impacted areas being the West, the Midwest, and the Northeast. However, again, when taking that into consideration and looking at this time last year, we're still relatively low. So what is the fall going to bring? We're not really sure yet. The experts do think that there might be an uptick in cases later in the fall. So we're thinking around October, early November. And to prevent this, the advice is to get vaccinated if you haven't yet, or to get boosted if you've already been vaccinated. Which leads me to the respiratory syncytial virus, RSV, because I'm sure by this time you've heard about a new RSV vaccine. So why should you care about RSV? RSV is a virus that typically impacts infants and can result in hospitalization. While it's more common in infants, it can impact immunocompromised people, elderly, and the young children. So that's what we saw last year. We saw a triple demic of COVID, influenza, and RSV. And now we thankfully have a vaccine against RSV. So who should get it? While everyone is recommended to get the annual flu vaccine and the COVID vaccine, not everyone is recommended as of yet to get the RSV vaccine. The CDC is recommending that infants less than 8 months old and infants 8 months to 19 months old, if they're at risk for severe illness, get vaccinated. And then there's also a newly approved vaccine for RSV for pregnant women. And there is a recommendation for people ages 60 and older to get immunized after consulting with their doctor. So you're probably like, cool, this is all great, but why should we care? What does this have to do with Health Equity Mondays? Well, we know that there are disparate rates of immunization among historically excluded communities. We know this very well from COVID, but the same could be said for childhood immunizations as well as flu. So the latest data is from 2017.
Wow.
So 6 years ago was the last time that the CDC looked at this data. And what it found was that in the American Indian Alaska Native population, children were 10% less likely to be fully immunized when compared to non-Hispanic white children. And then just 66.5% of Black children aged 19 to 35 months were fully immunized compared to 71.5% of white children. So if you're not like super familiar with all the vaccines that kids have to get, there's a vaccine schedule that the American Academy of Pediatrics puts out. And there are a series of vaccines that kids should get in order to be as healthy as possible. And when we say fully immunized, that means that kids have gotten all of the required vaccines and not the optional vaccines. So if you're ever interested in vaccines, I can talk a ton about it, especially childhood vaccines. But that's kind of the breakdown. When we look at flu vaccine, and this is specifically looking at the adult population, we have a little bit more recent data from 2021 to 2022 flu season, and that showed similar rates of disparities, with 42% of Black adults over age 18 receiving the flu vaccine compared to 53.9% of white adults. So it sounds all bad, but I'm going to show you some data that says that for COVID-19, it's actually not as bad. Well, so the Kaiser Family Foundation did a study of the race and ethnicity of people ages 5 years and older receiving a COVID-19 booster dose in the United States as of July 6, 2022. So last year, the Kaiser Family Foundation looked at this data, and what we see is that if we're looking at the booster dose, so that means that this is your second or your third COVID vaccine now, considering where we're at. The population actually seems to mimic about where the population size is for the respective racial groups. So looking at people who are fully vaccinated, 10% of the total population is Black that's vaccinated, 20% is Hispanic, 7% Asian, and then about 1% American Indian, Alaska Native. So when we look at this data, while there are some differences compared to the total population, it's actually not that bad. When we think about the total population of people who are vaccinated, 10% are Black, 20% Hispanic, 7% Asian, and then we have 56% white. And, you know, it's kind of around the population sizes when we look at the United States. So it's not alarming. It's definitely, it could be better, but I'm happy to see this because we all know that the COVID-19 vaccination efforts were huge and there were so many people that came to help with that. So it does look like it did paid off. I think, there are good things to say about that. This is also, August is the National Immunization Awareness Month, so it felt apropos to bring this up during this month so that everyone knows what to do for the fall when we get there. And hopefully you feel comfortable speaking to your doctor or public health workers to let you know what's appropriate for you in terms of vaccination. Or if you just have questions, because we know that there are a lot of questions still about vaccines, especially new ones when they come out. But hopefully this little tidbit of information makes you feel a little bit more comfortable and you go out and get vaccinated.
Absolutely. We hope that we are the community leaders and people that you'll look up to get this kind of information and use it to take actions on. I was actually reading an article that COVID-19 has increased a lot globally. I think the cases have spiked like 80% from July to August. In this article that I have here that I will share is that it says globally reported COVID-19 cases increased 80% over the past month compared to the previous month, according to the World Health Organization. That's nearly 1.5 million infections were reported from July 10th to August 6th. The UN Health Agency said in a weekly coronavirus report. And of course, we know, as Jasmine said, in the US now, we're not even tracking really cases by people reporting cases because that has become very much non-existent or very much less the case. Because if you think back to your life, if you've gotten COVID within the last couple of months, it is less likely that you've called the health agency and told them that you actually tested positive. So the numbers that we are getting are going to be skewed a lot. But I think it's just important, as Jasmine was saying, to just advocate for your community and just ensure that we are taking the steps to protect ourselves, especially with this new strain of COVID coming out. I think that I've seen in recommendations somewhere that people are saying wait until the new vaccine comes out later in this fall and then take that one. But just get a vaccine because the modifications on this this coronavirus strain isn't that different from previous strains, so vaccines are still going to be effective. If you'd like to wait to get a more effective vaccine, there's one that will be coming out in a couple of weeks. And especially as we go into colder months, definitely be sure to think about these things if you are immunocompromised or around older individuals.
Yes, and you can get the COVID vaccine and the flu vaccine at the same time. It's actually recommended. And like Omari said, the newest COVID vaccine should be out in a couple of weeks. And the recommendation is that you try and get it in September or October, before we go into the really cold months, which we know cause the increase in everything.
Yeah, so thanks for raising awareness on this because I don't think we have been talking much about what has been going on with COVID-19. So appreciate you sharing that.
Yes.